welcome everybody. Today I have the pleasure to speak to Dr. Therada, who is geriatrician, expert in sports medicine and medical hydrologist. And today we're talking about geriatric medicine. It's a pleasure to have you. Welcome and thanks for taking the time.
Hello, good morning, and it's a pleasure for me also to be here with you.
Thank you very much. So as said, you're a geriatrician, and can you tell us how do we treat elderly patients in our fasting clinic here in Marbella?
Yes, there are a lot of clients or patients we come with some kind of age. But age is not only a number, it's a compound of things. So we treat these patients or clients in a very personalized way. We individualize completely the treatments they're gonna have and all the protocols they're gonna have. So it's true that age shouldn't be stopped to do the fasting or a contraindication by itself to do a fasting. Is more the clinical situation of this client. So we do it very personalized in the clinic. And these old patients and clients that come here, they have their own medical problems. They are called geriatric syndromes. And it's very common that these patients have some incontinence, some problems to walk, some problems to sleep, memory problems, and falls sometimes. So it's something in the clinical story that we do. We see exactly what syndromes they have, geriatric syndromes, to take account and to put it in our point of view exactly to do the best on them.
Thank you very much for the introduction. What inspired you initially with this, like to study this, but also then with your background to come to a place like ours in a fasting clinic?
Yes, well, me myself, I was raised by my grandparents, so the old people for me is something very normal. And during the summer, we used to go to a very small village in the center of Spain, Pradena de Atienza, where 98% of the people were old. And I was a kid there many years. So for me to speak with old people and take problems and treatment, I think I understand pretty well the situation of the old patients. And then geriatrics is a specialization like internal medicine for old people. I could have the chance to do it in Madrid, in a clinical hospital, with the head of geriatrics in Spain. So it's something that I feel really comfortable to take care of these old patients from a personal, from a professional way also.
And from your experience as a doctor now being in the fasting clinic, is there a difference how elderly people experience fasting compared to younger ones?
Yeah, well, these old people or elderly people, they have a lot of knowledge. They have lived many years, so they have a lot of philosophy, and they know how to do the things well, actually. They have many experience in their lives. So they have been doing fasting probably before. It's not the first time. So they know what they are gonna expect, how their body and mind is gonna react, and they can concentrate in the things they really need, or they gives them more pleasure, or it gets better for their health. So actually they are examples of good fasting persons because of the experience they have.
And is there also a difference in how the body reacts?
Yes, as we say, they have most of them many pathologies. They have several medical chronic problems. Also, they have a lot of medication, some of them, and they have some high blood pressure. They are diabetic, cholesterol, and they have problems with musculoskeletal, with the joints, pains. So these patients and some geriatric syndromes, as we said, we have to take care of them very often. Okay, we have to see exactly if they have some acute problem or to have them in the best perfect state to avoid any kind of incidents. But actually most of them are chronic problems that we can control here with the medical team and with the nurses. We work all together also with the physiotherapists to know exactly what kind of physiotherapy we can do with them, what kind of exercise from the gym, from the personal trainers we should give. So actually there are patients who are very disciplined and they know what they're going to be doing here, and they see that all the team, all the different departments, they work together to get the best from them.
From your experience, do you think there are any geriatric contraindications for fasting?
Mhm. No, it could be like the rest of the contraindications for this kind of treatment, for the strict diets of fasting. Of course, there is something related with old, with elderly people, that it could be dementia, for example, or people who cannot move at all from the bed, or they can have a very stable life, they cannot do too much exercise. With this kind of patients, really is difficult to treat them here, especially with cognitive impairment problems and dementia and memory problems and conductual differences, problems with that. But the rest, I could say that it could have a chance to be a good treatment here with them.
So, and if there are maybe elderly people watching this video, or maybe younger ones recommending it to their parents or whatever, is there anything you would advise them to have a special eye on when elderly people would fast at home?
Yes, what we should say is that the equilibrium, the balance in life is always recommendable. And these patients, they should have some balance in their activity. For example, the physical activity, the intellectual activity is so important to be psychostimulated also. It's important to have movement, they have to move. And also from the other point of view, artistic development is important, emotional is important, psychologically also. So having in equilibrium, in balance, all these items is something that they should get better. So here they have the different departments we work with, psychology, physio, so we can concentrate in the problem is most needed in this case. But yes, if we can have a balance between all these things, so a diet, nutrition, physical exercise, psychological, emotional, artistic, okay, that would be the best advice we could give them to have a nice elderly state, and to prevent also acute events in the future, and to do some kind of anti-aging, or I would say healthy aging living, to get better quality of life, which quality of life would be the best we could offer to this kind of clients.
Anyway, we recommend people, if they fast at home, to see their doctor regularly. Most likely this is especially needed when people are in higher age already, right?
Yes, that's right. Yeah, some of them are fragile, okay. They have a lot of knowledge, they have a lot of experience, but physically and maybe psychologically, with memory problems, sometimes they are in some kind of fragile state, similar to a boy, I mean, to a young person, so a baby. So we should take care of that and treat them with a lot of love, and help them as much as possible. They have to feel that they are understood by the doctor and the specialist who treat them. They don't treat them as a problem, as a pathology, as a medical diagnosis, but as a complete person who had a great life and a lot of experience, and also we can learn a lot from them.
Absolutely true. As a geriatrician, what are your top tips to age in grace?
Well, the main topics to have illusions, to be happy as much as possible, to enjoy love, all the relatives, all the friends, but always to have some plans in the future. Okay, always have some illusion in something, small, bigger, whatever, but to have something, put the side, the view in something in front of them, to continue doing things and learning things. And yes, a combination of that, the exercise and intellectual activity, and some also artistic, if they like to do something artistic, continue doing it, or come back to those things that they love at the beginning that they couldn't do when they was working and they was in some parts of their life very busy, and now they have the time to enjoy all those things. That would be a good advice, I think.
Thank you very much for that interesting talk. I hope you also found it beneficial. If you did so, follow us, leave us a like. If you have questions, leave the comment below, and I hope to see you soon. Thank you very much once again for taking the time, and I'm already looking forward to our next interviews.
Thank you. It's a pleasure for me also to be with you here.
Thank you very much. See you soon. Bye-bye.